Hi, so today we'll be speaking with Monsieur Heritier Nosso from the Healthy Androscoggin organization, and just to get to know some more about your work. And so my first question is, how has the COVID-19 pandemic affected your work with Healthy Androscoggin since the beginning of the pandemic?
Yes, so thank you so much, Isaac, for this opportunity. First of all, you want me to do only English or to combine French?
Oui,
Or-
on peut includer un peu de français si tu veux, ou si vous voulez, bien sûr.
Okay, so let's see. I have three languages that I do speak: French, Lingala, and English. So yeah, we can do that in English, and
Oui,
sometimes French words
yeah,
can
yeah,
be
for
as well.
sure.
So yes, the pandemic has been so difficult for a lot of people and myself. So one of the works that I do is to, one of the work that I do is lead poisoning resident education. So with this work, I go to visit the tenants to educate them about lead poisoning. So with the pandemic, it was so difficult to visit people in person to educate them about lead poisoning. We were trying to do that virtually via Zoom or WhatsApp or FaceTime, but that was also a big challenge because, you know, if somebody that you never met with calls you and tell you, hey, I have this, I do this, I would like to do that person result education. So some people were a little bit hesitant to be to open to welcome a virtual meeting because they never met you. So this was one of the challenges that I did encounter. I do also remember we had to organize some workshops. So most of these workshops used to be held in person, but with the pandemic, we had to have it hybrid, like we have like speakers intervening online and participant in person and with a limited number of people. So this is how the pandemic has affected my work.
And so the work you were talking about at first with going to your community to neighbors, was that through the neighbor to neighbor program?
Uh, the Never to Never program is something else.
Oh, something else. Oh, okay. So
Yes, so what I was doing is just with lead poisoning. We have a program here in Lewiston Urban that we call Lewiston Urban Lead Poisoning Program. So under this project, Healthy Androscoggin provides lead poisoning education. So my work, apart from organizing workshops to raise people awareness about lead poisoning, I was going to visit the tenants to educate them about lead poisoning before the abatements.
and so could yeah. Sorry. So could you speak a little more about a little bit just to clarify which programs you're involved in, like at Healthy Androscoggin broadly?
Yes, exactly. So I I do a lot of projects at Healthy Androscoggin. So one of them is what I just told you, which is a neighbor to neighbor program. No, I mean, which is lead education. So I do lead poisoning awareness. I do organize workshops. I do also internet education about lead poisoning. So this is one. Uh, One thing else I do is what we call neighbor to neighbor program. So neighbor to neighbor is a model which consists to train the community leaders in the community. Usually we recruit people from different countries different cultures. So we educate these leaders. The education can be, the training can be about lead poisoning, about healthy homes, about nutrition and physical activities. So after the training, the leaders who attend the program, we call them ambassadors. So they go to visit their friends, their neighbors, to educate them about what they learn from the training. So this is one thing also that I do. It's like one of the routine work that I do at the Heritier Nosso. I am also involved in a smoke-free policy. So I meet with landlords to encourage them to pass the smoke-free policy, which meets the model of main CDC, because main CDC has a model of policy which includes marijuana and e-cigarettes. So many landlords have the policies. Some also do not have them, but those who have them, their policies do not meet the model of main CDC, because it's just recently that the state of Maine has legalized marijuana. So some landlords have the policies, but they do not include marijuana statements or e-cigarettes. So my work is to help landlords to create policies, and also especially to create ones will meet the model of main CDC. So this is also the work that I usually do with Heritier Nosso. So I do also like colorectal cancer. I do organize workshops to educate
Sounds
County
like,
residents, Androscoggin County residents, especially new members, about colorectal cancer. Yeah, did I answer your question?
That sounds like plenty. I'm sure you have a very busy schedule, and so again, thank you for taking the time out. Just to circle back to COVID-19 real quick, you spoke about trying to get involved with the neighbors or some of the community members about the lead prevention program, and educating them. But how do you think they've fared? How do you think the immigrant community has fared overall with the COVID-19 pandemic? Do you think they've been more so affected? And if so, do you think certain community-based organizations, or I guess community members, have been able to step up instead of the main government or the Lewiston government?
Yes. So with the pandemic, we, everybody knows the history of the pandemic. How we were hearing about it from far, and people were not believing that it would happen. So what did happen when we didn't have the pandemic here? So one of the challenges among immigrant populations was one that the rumors, the stereotypes, the false beliefs about COVID-19. So when we had cases in Europe or in China, so a lot of people were saying, COVID-19 will not happen in USA, or COVID-19 will not affect Black people, so it will affect only white people. So this is one of the first beliefs that a lot of people had, and a lot of people were not afraid or didn't want to care about protecting themselves, because they don't know, I'm Black, Corona will not affect us. And some people usually used to say that, hey, I'm a Black person, like I'm a Congolese, I eat fufu. And fufu is like one of the main foods that a lot of people eat in Africa, especially people from the Congo. So a lot of people know about fufu. So some people were saying, hey, no, I eat fufu and fufu will protect me against coronavirus because I also eat bio since I was a kid. So I have a good immune system. So I'm not afraid of coronavirus. So this was one of the rumors that people heard. The second one, when we had cases here in the United States, a lot of people continued to believe, no, even we have it here, but this is just for white people. It won't affect us as African people. One of the examples is we don't have COVID-19 in Africa. So this is how the beliefs that people had. And when we heard some cases of a COVID-19, like among Congolese people in Europe, and no, when we heard about some African and African American people who were affected by COVID in USA, and a lot of people were, oh no, this is even they are like black, but these are African American people. They were born here, so we came from Africa. We always ate bio, so this shouldn't affect us. So this experience I'm sharing with you is mostly for many African people that I was meeting, and I mostly work with numerous from Central Africa because of the language. We send the same languages. Even I work with anybody, but mostly those from South Africa. So these beliefs rumors are mostly from those that who live there. Oh no, African American people who were born here, they are not like us. So this is not a problem for us. So this is like the first challenge and the first barrier. The other challenge was religious challenge. So some people say that, no, this is biblical. It's in the Bible that this will happen. And I believe that as I am a Christian, it will not affect me. This is what I was hearing a lot from a lot of people. And I do also remember that some people say that this is, I think many people are familiar with 666. So people say that COVID-19 is here because the government or those who do not believe to God wanted to put to people.
So like a biomedical like a bio or a weapon from the government.
No, yes, they say like the government doesn't believe to God. So in the Bible, they say that at the end of the world, they will need to put people, the sign, call it 666. So 666 en français.
Oui.
So 666. So one of the way to put to people this sign, the sign is related to the devil, according to the Christians. So one of the way to put people these signs, because if you don't have, according to the Bible, if you don't have the sign 666, you will not be able to buy stuff or to do a lot of things. So they say that COVID-19 had the link with vaccine. So it was created in order to convince the population or to require them to get vaccines. And so vaccines will be a way to put that sign, which is from the devil, in a human being. You know what I'm saying?
Yeah.
So this is what they believe of people. No, I am Christian. This is created in order to connect us to the devil. So we don't believe to that. So this is also one of the rumors that people had. Another rumor was also a lot of humanists didn't want to go even to the hospitals because they saw some videos. I'm not sure, I cannot interpret about these videos, whether they are true or false, but according to these videos, there were some African people who were in the hospitals, but the doctors didn't want to take care of them because they consider that as a racism act. So they didn't want to take care of them. They didn't want to treat them, and a lot of people, some people died. So there was like a video on the social media. A lot of people share these videos. So this is the reason why a lot of Numeners didn't want even to get tested, because for a lot of Numeners, it was when you go to get tested, they will try to hospitalize you to study, to use you as an object to study COVID-19, or also, or maybe to kill you, because they want to eliminate African people or Black people.
Yeah.
So I do remember even somebody was sick, so he was hesitant. This person trusted me. This person, he shares with me every problem that he has, like money, social security, everything. But when he had symptoms, he thought is a fancy. No, I cannot. I'm afraid to tell Heritier, because if I tell Heritier, Heritier may tell me to go to the hospital. I don't want to go to the hospital because they may kill me. And then later, when he was feeling sick, he called me and shared that with me. I'm sick. What can I do? So you see, these were like the challenges to among human communities. And then what will happen? We had a lot of cases in human communities, like in
Lewiston specifically.
Yes, like in men, people of color are like 10 times affected by COVID-19 than other like white people. So that's why we say we talk about COVID-19 racial disparities. So this was one of the challenges. So the first challenge was about all of these rumors, but the second challenge, I mean, realities that humans were facing is, humans are hard workers. So a lot of people here, even in men, when I go on Facebook, I see people commenting against humans. Sometimes I laugh and I tell myself that a lot of people do not know what is going on. And I always like to tell people that many companies in men continues to exist because of humans. If humans were not here, men as the older states, many companies would close. People do not need like statistics. If you go to many companies, like to Harvard, they are making testing for testing kits for COVID-19. If you go to places like LNB, you go to Dingley, you go to Go Homes, you will see in most of these places a lot of humans work over there. You can be somewhere, you see like Walmart, you see 5 languages are spoken at the same time. Sometimes people do not feel even they are in USA, because you can end up somewhere, most of your colleagues are from human communities. So humans work so hard, and most of us also are essential workers. Yes. So even myself, apart from the work that I do for Androscoggin, I work also as a DSP. So you see, we were in higher risk, because like most of us were like DSP, that's about professionals. So you go to group homes, you have to go to do like 2 works, because humans are hard workers. They work like 2 or 3 jobs. So you can go to different works, jobs, and then you can get contaminated, and you will see many humans from many countries. They live like in the same room, a lot of people. Most of American people have like 2 children, but in African communities, most of people like to give birth, to have like to create a family. And not just that, people love also to live in community. Like for family is not just your child or your sister or your brother. Family is even your cousin, even your friend is your family. Example for you guys, for American people, it makes sense that you get married, you don't give birth. But for us, when you get married and you wait to give birth in 2 years, it doesn't make sense. For us, when you get married, you need to give birth right away for most of people. So we are a lot of people in our households. So going to work from many places as essential workers, a lot of people, even they are trying to do their best to protect themselves,
For sure.
but they were like in higher risk because you have to combine different houses to treat people. I mean, to work as a CNS, to work as a DSP, to do like essential work. So all of these things did expose new miners. And I'm sorry that even though many new men did sacrifice their life to see what is going on with the government taking the, the harmful decisions which affect now new miners or immigrants. It's so sad. It looks like the government is not grateful to new miners because
Yeah.
we are everywhere.
Yeah.
So
I'm sure that you've had to deal with plenty of instances that were probably not the greatest from fellow white citizens, and that was one thing that we spoke with Zamzam Muhammad in our class at one point, and yeah, her stories were just amazing, her contributions. And so, but it's not, just to get back to what you're saying, it's not surprising what you're saying about like the heavy suspicion with the government or just the hospitals, just the institutions. And we read about that in like one of the Washington Post articles, and obviously it's not a first-hand account. It doesn't really mean anything for us to read
so
about.
this is this is how coronavirus was affected, but many organizations, especially those who work with new miners and the cities, main CDC. So we try to work hard like Catholic charities, um, Lewiston Urban Task Force, Immigrant Resources of Men, and immigrant coalitions with Mufalo. So we did work hard to try to educate our communities. We organized it like virtual workshops, like the ECBOs, like Congolese communities and other communities. So we had to organize like events to educate people, to provide masks, like Heritier Nosso. We have worked with Catholic charities and the churches because a lot of new miners trust their pastors. So we did COVID-19 video with the pastors to educate people, especially for those who believe that COVID-19 is something spiritual, that by praying God, you will not be affected by COVID-19. So we contacted the pastors to be recorded on video to educate the populations about COVID-19. So you see people who are like Christian, when they see like their pastor, or people who are Muslims, when they see their imams talking to them about COVID-19, they can say, oh, no, this should be serious. So I need to protect myself. So this is what we have done. And together with many organizations, we did also help a lot of new miners who apply for unemployment benefit and insurance, because like myself, I knew a lot of people who were struggling at home. They didn't know because of language barrier that they were entitled to apply for unemployment benefits. They could apply for rent relief. So this is the work that all of us with many organizations, Catholic charities, Heritier Nosso, Lewiston Task Force here in Lewiston, Immigrant Resources of Men, most of us worked hard to educate new men and communities, to advise them to get tested and to
it is remarkable how you're able to. I mean, the new Mainer community is very very diverse. With, I mean, I'm sure you just like the amount of nationalities that are represented, the amount of languages. I saw in the YouTube video on Heritier Nosso, the different, like, there must have been at least a dozen languages that were for that COVID-19 message about washing your hands. And so I'm surprised. How do you think, or I guess my question should be, how have you guys been able to address the immigrant or the new Mainer community as a whole? And do you think any, or like, could you speak on like the challenges that you face when like addressing like such a like diverse community within itself, but that's labeled as this one blanket term? Or if you.
Yes, so this is a good question. You see, as you said, that men is now diverse. So many languages, many people from different countries, different background and cultures. So we do have a coalition. We call it Immigrant Rights Coalition. So it's led actually by Mufalo. So all of us, we have also NMMCC, Women Community Collaboratives. So all of these organizations are like platforms, and you have like many ECBOs and organizations involved with. So what we are doing was to connect all of these organizations to discuss together. So this is the problem. Like we have in our meetings, organizations who work with Congolese, Somali, Angolans, people from Numians from Djibouti, like different people, and together we're discussing what to do. So the decisions, the ideas was taken by all of us to see what we can do. And most of our products were like translated in different languages and taken to Catholic charities, which work so hard to help with the translations, and also MEN CDC and the city of Lewiston, and did also help, and Oben did also help a lot, providing technical assistance. Our police with Joe, they helped a lot to educate Numians with funding, with activities, with also the translations, like the videos that we provided, we produced it on COVID-19. That video, was produced in 7 languages. We had also the mayors, both mayors of Lewiston and Oben, did speak. So this is the way that we did try to educate our communities with like Somali, Mai, Lingala, French, Portuguese, English, Spanish too. So that was the way that we did, or educate people from different communities or cultures.
Yeah, I mean, that's amazing. And I'm sure that in the time of crisis that there might be a little more, there's definitely more instinct to come together. In normal times, do you end up facing issues though with the differences in the community? Do like some people with Healthy Androscoggin or your work personally, do you think that the community, like, it all gets like fractured somewhat? Or I guess I don't know. I'm just, it just doesn't really seem practical to me that like this whole group gets lumped together, even though it is so diverse. But I mean, we have a little bit more time, so I guess as a final question, or as a little to where to go, would you mind talking about your own journey from Congo to Lewiston to community leader? And if you want, on peut faire ça un peu en français, si tu veux, ou un peu quelque chose comme ça.
Yeah, of course. On va le faire en français.
Oui.
Le mot anglais pourrait toujours revenir, comme tu le sais que actuellement, je passe plus mes journées en français, puisque je passe plus le temps au travail. Et donc, beaucoup de mots anglais vont interférer dans notre conversation. Et en fait, je viens de la République démocratique du Congo, et en RDC, je travaille comme avocat près la cour d'appel. Et à part la profession d'avocat, je travaille aussi je dirigeais beaucoup d'organisations non gouvernementales, et spécialement seul travaillant dans le domaine de VIH-Sida, santé de la production, environnement, démocratie et paix. Je formais aussi le défenseur des droits humains. Et je suis venu aux États-Unis depuis 2015. Avant de venir aux États-Unis, je ne connaissais pas MEN. Donc, je connais MEN quand je suis arrivé aux États-Unis, grâce à un ami qui vit au Texas. Et aussi, ici à MEN, je ne parlais pas l'anglais quand je suis venu aux États-Unis.
Oui.
À l'école, on travaille quand même du moins fort en anglais. Déjà, on avait un peu de qualité en ce qui concerne la grammaire, puisqu'on étudiait l'anglais à l'école, comme beaucoup de gens étudient le français ici aux États-Unis. Mais parler couramment l'anglais ou parler l'anglais, c'était difficile pour moi.
Oui, c'était une issue en français, école américaine, comme on étudiait français, mais c'était pas vraiment comme.
Oui, exactement. C'était les mêmes cas aussi en République démocratique du Congo. Et non seulement ça, c'était les British English too. On nous apprenait plus le verbe, mais je ne parlais pas l'anglais et l'intégration était très difficile. Quand je suis arrivé ici, tu vois, tu te retrouves dans un pays, tu vas approcher les gens, mais à cause de la langue, c'était très difficile. Je me rappelle un jour, j'étais en train de marcher vers Kennedy Park et Bates College organiser un événement. J'étais curieux pour demander de quoi s'agissait-il. Je disais aux gens, mais les gens ne m'écoutaient pas. Je me suis même demandé, j'ai demandé à quelqu'un, OK, ce que je fais, c'était juste, comme les gens ne me comprenaient pas, j'ai demandé, do you speak French? Do you speak French? Je parle français. Et on m'a connecté avec Sam Boss, qui travaille avec Bates College. C'est lui qui m'avait, OK, je parle français, c'est lui qui m'avait expliqué.
Je ne savais pas
Voilà.
que pouvait parler en français.
Pardon?
Je ne savais pas que Dr. Boss ou Sam pouvait parler.
Oui, il parle bien français et c'est lui
Bon.
qui m'a beaucoup aidé. Je crois qu'il est mon premier ami francophone
Bon.
que je connais ici. Et
Rigolo.
le premier ami américain francophone que je connais ici. Donc, on m'a introduit celui, OK, ce jeune homme parle français et Sam Boss m'a expliqué ce qui s'est passé. Il m'a invité aussi à Bates College et c'est celui qui est vraiment l'un de mes mentors ici aux États-Unis parce qu'il me donnait beaucoup, prodiguait de conseils. Il m'enseignait aussi l'anglais puisque quand on se parlait, quand j'ai des questions, je lui posais, tu peux me traduire cette phrase en anglais, comment dire ça en anglais, comment dire ça en tout cas, on échangeait, lui aussi me posait des questions en français et il m'a beaucoup aidé. J'avais l'habitude d'écrire tout ce que je ne comprenais pas, il m'avait beaucoup orienté. Donc, c'est de cette manière que je suis arrivé aux États-Unis et c'était très difficile parce que moi, je voulais bien travailler dans le domaine, aider la communauté, mais la langue était une barrière pour moi. Je voudrais même pratiquer aussi le droit, mais la langue était une barrière pour moi. Je me rappelle, comme nous bénéficions de l'assistance des City of Lewiston, ce que nous devons rendre à la City en contrepartie était de travail comme volontaire. Moi, on m'avait I was assigned to volunteer with the Lewiston Public Works. Donc, je travaille comme volontaire là-bas, balayer les routes. Alors, je me disais, bon, moi, en tant qu'avocat au Congo, j'aurais plus voulu travailler plus white collar job et puis faire plus travailler mon intellect au lieu de juste balayer, qui n'est pas mauvais aussi parce qu'il n'y a pas de sous-métier, mais je voudrais plus je me retrouverai plus dans mon assiette quand je travaille pour la communauté dans des ONG où je travaille comme avocat. Alors, j'avais écrit à Thier, il a demandé, OK, je voudrais quitter ici, je voudrais travailler dans un environnement qui pourrait aussi m'aider à se propulser, à connaître la langue, parce que là où je travaille, je ne parle pas avec les gens. La plupart des personnes que je parle avec sont des Congolais, on parlait Kalingala, donc c'était difficile pour moi pour améliorer, pour perfectionner la langue. Et Dieu m'a dit, OK, tu peux aller travailler quelque part, tu cherches une organisation où tu peux aller travailler. Je suis allé dans une organisation de la place qui était une ONG aussi. On me dit que non, on ne va pas te prendre comme volontaire, c'est parce que tu ne parles pas l'anglais. Ou on essaie de se parler l'anglais, mais il ne m'écoutait pas très bien. Et la personne m'a dit, non, tu ne vas pas travailler comme volontaire, c'est parce que tu ne sauras pas être en conversation, parler avec notre boss. J'ai insisté, j'ai dit, même si je ne parle pas l'anglais, mais j'ai l'expérience, je peux, l'handicap ne doit pas être un sujet de disqualification, je peux toujours aider. Je peux toujours contribuer avec mon courage, je parle beaucoup de langues, je peux faire des choses. Et la personne là m'a soumis à un test de lire en anglais. Quand je lis en anglais, et il m'a dit, tu vois, avec l'anglais aussi américain, c'est question de prononciation, tu vois. L'anglais parler comme ça, c'est un peu difficile, mais quand il faut lire, on avait quand même l'idée de comprendre, puisque l'accent anglais, c'est ce qui était très difficile. Alors, il m'a passé un test. Quand j'ai passé les tests, c'était bien passé. Il me dit, OK, tu vas travailler c'est comme volontaire pendant 1 mois. Et si tu n'améliores pas ton anglais, en tout cas, on va prendre la décision que tu ne puisses plus continuer avec nous. Je suis resté pendant 1 mois et puis je travaille très bien. Tout le monde, j'avais vraiment apporté des innovations. Et quand j'étais autorisé de travailler, on m'avait engagé dans cette organisation. Donc, j'avais un peu de courage pour voir comment m'intégrer. Alors, comme c'est quelque chose que j'aimais beaucoup, je faisais l'effort d'apprendre l'anglais à la maison, de discuter avec des amis seulement en anglais et de rencontrer des amis américains. Je vois par exemple une amie à l'Irabido qui m'aidait beaucoup. On ne parlait pas la même langue, mais quand on se voit, elle était aussi étudiante à Bates College. Quand on se voyait, on essayait juste de parler en anglais, d'utiliser Google Translate. C'est ce que je faisais à travers la musique. J'écoutais beaucoup de musique américaine juste pour apprendre l'anglais. Et c'est de cette manière que j'étais en mesure de me communiquer en anglais. Et voilà un peu comment je me suis intégré et je travaille plus dans des organisations non gouvernementales. Et l'un de mes objectifs est de retourner encore dans la profession que j'adore beaucoup comme avocat.
Et maintenant, vous travaillez avec sa femme à Healthy Androscoggin.
Et je travaille avec la femme de Sambos. D'ailleurs, elle est ma manager.
Bon.
Yeah, she's one of my managers.
Son patron.
Le monde, c'est comme un village planétaire. Donc,
oui.
on s'est rencontré avec Sambos et maintenant, ça fait 2 ans que je travaille à Androscoggin.
Ouais.
Il y a aussi beaucoup de francophones à Androscoggin. Notre boss, Erin Gray, est francophone aussi. L'une des membres, non, pas du tout francophone, mais elle parle français. Et puis, Hali Lasagne, qui est ma manager aussi, parle français.
Alors, je pense que ça constitue une bonne discussion, ça. So, thank you for joining me. And yeah, just thank you for giving me the time and yeah, providing me some more knowledge about your work and your journey here.
Yeah, will you edit the video?
Yeah, I'll just I mean, boss, yes, Dr. Boss will look through it and see what he wants.
So if you notice that, I have an accent, so if for some reasons you think some phrases were not understood, so feel free to let me know. We can always redo the video.
Oh yeah, no worries. I mean, your English is very good for someone who's like had to learn it in like the latter half or more recently, like after everything. But yeah, thank you so much. Yeah. Merci beaucoup.
C'est moi qui te remercie, Zach.
Quoi?
Au revoir. Comme ça, nous allons rester en contact.
Oui, bien sûr. Ça serait. I'd love to be involved more with. I'd love to get to know some more about your organization. Yeah, stay in contact. Alors, merci beaucoup.
Merci. Au revoir.
Au revoir.